many of you already know and are familiar with the Remy laser, which is sponsoring tonight's presentation, as well as Dr. David Zuckerman, who is, the man behind the curtain, the wizard of Remy land, I suppose we could say. But I'm very excited because a lot of times David presents on his own, and it's really nice to have somebody here this evening who walks the walk and talks the talk and is actually using the Remy laser in practice every single day for a variety of conditions. And then obviously you can tell by the title of tonight's webinar that we are focusing on the pain characteristics or capabilities of the Remy laser, and specifically heel pain. And so with that, we have Dr. Adriana Strumbu. So thank you so much, Dr. Strumbu, for joining us this evening. Just a quick introduction. She practices in, I don't know if I'm pronouncing this correctly, so feel free to say it the right way if I'm not saying it accurately. Hallandale Beach, Florida. Sounds nicer than Central Illinois, so I'm jealous of you. And she's also a member of the Florida Podiatric Medical Association as vice president. And in 2020, she was recognized as Podiatrist of the Year. So kudos to Dr. Strumbu. Dr. Strumbu, like I said, she does use the Remy Class 4 laser for several inflammatory conditions and is finding great success. I sound like Borat in treating heel pain. But tonight she's going to be discussing the scientific evidence. So there are peer-reviewed journals that, and David is obviously going to chime in here and there to talk about the science behind Class 4 lasers. And we also get into how the science and photobiomodulation of the laser. So we'll also discuss why high-powered lasers are so much more effective than low-powered lasers, and really why the wattage of the Remy laser is ultimately ideal for the podiatric physician. The settings that David has programmed into the Remy laser are, cut and dry for the podiatric physician. There's never been a more streamlined turnkey Class 4 laser for the podiatric practice. So I'm excited for you guys to learn more about it if you haven't already gotten your hands on one yourself, because I do see some names of people who do have the Remy laser, which, David, feel free, it would be interesting for anybody who has been using the technology in their practice for the last couple of years to chime in on their experiences as well, because I know, Dr. Strumbu, you're going to be sharing at least one case study, hopefully maybe a couple of more, but we do have individuals online tonight that have it in their practice. So if you don't have questions to ask, feel free to just share your stories, because we love to hear about successes. So I said a lot really fast, and I feel like I'm talking a mile a minute, but I'm going to go ahead and turn it over. David, if you would like to say a few things about Dr. Strumbu and your relationship, feel free. And then Dr. Strumbu, you can take it away with your presentation. And I'm going to look for that video that was coming up in a little bit.
Okay, I'm excited tonight because I've never really seen this lecture. It was originally performed at the SAM in Florida by Adriana, and I'm excited. We've known each other for a few years. I personally think she's going to be someday the APMA president, but it takes time. Very smart, intelligent woman with amazing insight. So I'd love to hear this lecture.
Thank you so much, Sarah. Thank you, Dr. Zuckerman. So without much further ado, let's go into this lecture. We're going to talk about use of therapeutic laser for the heel pain. And these are some learning objectives. Understand the research showing evidence of positive outcome using light therapy to treat inflammatory conditions, understanding the effects of photobiomodulation, understand why a high-power laser increases tissue absorption, understand the laser treatment process for heel pain, and understand how to communicate the effects of laser therapy to the patient. Oopsie, let's see, it doesn't wanna. Okay, application of therapeutic laser therapy. The use of photobiomodulation versus thermal energy. And these are some pathologies that we use the lasers for. For example, arthritis, foot pain, neuropathy, plantar fasciitis, Achilles tendonitis, DJD, a lot of different pathologies that we use lasers for. And we're gonna get in more details about photomodulation. And here is the case for class 4 lasers in podiatry. Why do we use them? Patient acceptance is very high, no worries for at-home compliance. It's a painless treatment process, non-invasive, no needles are necessary, no injections, is drug-free, no adverse side effects, and there is no risk in too many treatments. It's very easy to use. Outcomes. Evidence shows that photochemical reactions in laser create desired results for inflammatory conditions attributed to the heel pain, such as plantar fasciitis, PT dysfunction, tendonitis, any tendonitis like Achilles tendonitis, Baxter's nerve entrapment, trauma, basically any inflammatory condition. And we're gonna look at some studies tonight. The first one, it's a meta-analysis of 22 articles. So what they did, they aggregated 22 articles to look at the overall effect of phototherapy on pain. And what they found was that laser phototherapy effectively relieves pain of various etiologies and making it a valuable addition to pain management treatment. Oops, I don't know why I'm having trouble with forwarding. Okay, this is another study. This is from Lasers and Medical Science. This is from 2018, and it looks at the high intensity versus low intensity laser therapy and management of plantar fasciitis. Is a random clinical trial. And what they did, they took 70 patients and they split it in half, and they used on half of them high intensity laser 3 times a week over a period of 3 weeks. And in the other group, they used low intensity laser, the same thing, 3 times a week for a period of 3 weeks. And both groups show significant improvement. However, the high intensity demonstrated better improvement than the low intensity laser treatment. Another study, this one is from International Journal of Sports Physical Therapy. And it talks about photobiomodulation therapy plus usual care. It's better than the usual care alone for the plantar fasciitis. And what they did, they split the patients. They took 3 groups. One, and the first group, they used the usual care. And the second group, they used the usual care and 9 doses of photobiomodulation of 25 watts. And the third group, they used the usual group care with 9 doses of photobiomodulation of 10 watts. For 3 weeks, they did this for each group. And what they found that the photobiomodulation group experienced a reduction in pain over the first 3 weeks, after which their pain level remained mostly constant, while the usual care group experienced a smaller reduction in pain. This is another study, and this is from the Turkish Journal of Physical Medicine and Rehabilitation, and it compares the low-level laser therapy and cortisone injection in the treatment of plantar fasciitis. So what they did in this group, they took 56 patients and they divided in 2. One group, they got only the 1 cortisone injection, and the second group, they did laser. And when both low level laser therapy and local cortisone injection for plantar fasciitis have positive effects for 3 months after the treatment. However, the laser therapy is more effective than the local cortisone injection at the end of the 3rd month in the local tenderness. The next study that we're going to look at is cold air therapy and high energy lasers versus the shock wave. So again, they had 2 groups. And what they did 10 daily sessions of laser therapy plus cold air on one group. And on the other group, what they did shock wave therapy, 3 sessions at 3 to 4 days intervals. And what they found that high laser treatment gave quicker and better pain relief than the shock wave therapy. So these were the 4 studies that we looked at, 5 studies that we looked at. Photobiomodulation. What is photobiomodulation? It's light therapy. It's used for stimulation of cell function. The biological effect is photochemical, not thermal, as is in the case with surgical lasers. The photochemical reaction lead to reduction or elimination in pain and decreases inflammation. Okay, how does it work with the photobiomodulation? Once the light is absorbed by chromophores, the ATP is produced and results in increased white blood cells. The oxygen and blood flow is increased and results in an environment for expedited healing, so that the high power class 4 laser energy speed healing up by nearly 300 times the normal rate. Oops, I don't know why I'm having so much trouble with forwarding this, the slides.
Maybe they could, I don't know if they're on.
It doesn't let me. Oh, here.
Yeah, I was gonna say, try to like click. Yeah, go ahead and just hit next. But
it doesn't let me. I don't understand.
Can you hit? Are you using your mouse or are you using your keyboard?
Here we go. I'm using my hand. Yeah.
Okay. Yeah. I was gonna say maybe try to use your mouse and click.
Yeah, I don't have a mouse.
Gotcha. Yeah. Okay. Or maybe hit enter. If you hit enter or shift, that might work.
Enter. Maybe enter. So here are some healing benefits of the laser photobiomodulation, which are increased circulation, increased metabolic activity, muscle relaxation, accelerated cell reproduction and growth, immune stimulation, stimulation of nerve regeneration, improve vascular activity, enhance ATP production, increase protein synthesis, improve wound healing. So there is a lot of benefits that we get from photobiomodulation. Why do some therapeutic lasers fail? As light energy hits the surface of the skin on the deeper level, some of it is absorbed, but some of it is scattered, and some of it is reflected. At each tissue interface, less energy is available to pass further through to the next layer because the effects of absorption and reflection and transmissions. Some other causes are underpenetration or underdosage. So how do you know if you are doing the right dosage? The best way is to do a pre and post treatment palpation. Is the only way to determine if the laser will help and will be a success. So what you do, you palpate the area, and where the patient has pain, then you do a treatment, say for like 5 minutes or so. And then after you do the treatment, you check it again, and you will see that if it works, there's no more pain there. But that's the best way to determine if you did the right doses and time. If it's not, the pain didn't go away, basically what I do, I add another minute or two and it will help a lot. Okay, importance of power density. Power is the rate of which energy is delivered and is shown in levels of wattage. So power density will equal intensity. Since approximately 65% of the energy delivered is lost in the epidermis, if you don't start with enough energy on the skin, there will be not enough to stimulate cell healing in deeper tissue. If you do not have sustained power density over a long enough period of time, treatments may be ineffective. But again, like I was telling you before, palpation is the only true determinant as each patient is unique. So the only way to know for sure is you have to palpate. Okay, by using a dual wavelength laser, the laser beam penetration is reduced by 50%. With a 50% duty cycle setting and dual wavelengths, laser penetration is equal to 1/4 of the stated power output of the laser. When you use a dual wavelength of 980 and 810, you are able to harness the benefits of greater power without the pain to the patient. So that means the patient doesn't feel it. And really, I get great results. The patient never complained that the laser, it's too hot or painful. Actually, the patient really tolerated very, very well. 30-watt laser for the foot and ankle. More power equates to deeper penetration, faster delivery of the proper therapeutic dosage, and ultimately better outcome. A 30-watt laser will not only penetrate deeper, it will put more therapeutic energy to target pathology. It will do so 3 times faster than a 10-watt laser and 5 times faster than a 12-watt laser with a duty cycle of 50%. And here is the recommended protocol. So what I use this laser for? Mainly I use it for plantar fasciitis, but any inflammatory conditions such as Achilles tendonitis, posterior tibial dysfunction, Braxton nerve entrapment. I also use this for capsulitis. And these are the main things. Any inflammation you could use it for. The wattage and wavelength, these are 25 watts, wavelength 980, 8010, 810. Treatment, how long do you do the treatment? I do it for 5 minutes to 10 minutes. In general, I start with 5 minutes and I do it either 2 times a week for 3 weeks or 3 times a week for 2 weeks. And then you see if the patient, if the pain subsides in 6 sessions, I start with 6 sessions. But if the pain subsides in 6 sessions, they're fine. They don't have to continue. If it got better, and then they can do another set. I sell it in packages of 6. I never encourage for them to do one. A lot of patients say, oh, I'll start with 1 and then I'll see. I said, I will not sell you a 1. If you want to get it, you must get it in a package of 6. And if they really insist on a package on a 1, then I charge them. I charge them a lot for a 1 session as opposed to a package. So Dr. Zuckerman, you want to jump in here with
I don't know if I want to come to you. You're expensive. It's the beauty of the pain is that you, not 100% of the time, but in a significant amount of times, you can get them out of pain the first visit. So we always say to them, we're going to determine if you're a good candidate. You treat them. Remember, we talked about palpation, and palpation is when you hit the right dosage, you're going to get significant. It's all about dosage and power density. And when you palpate and you get let's say you just get, it feels better, that's under dose. So you have to do it longer. The average is 5 minutes, but it could be 6 minutes, 1 or 2 minutes to get significant. So if a patient's out of significant pain, that gives them a taste of what to expect. But we teach them, hey, part one is we got you out of pain, but you got to get something, you got to get it to heal, just like a broken bone. So we prescribe or recommend 6 treatments to get it to heal. So part one is to determine if they're a good candidate, and part two is to get it to heal. And I love analogies. When we talk about a good analogy to determine how you've hit the right dosage, like a dead battery in a car. If you hook up the jumper cables and charge the battery, and if the engine doesn't turn over, what do? You charge it longer, and you know it's done when the engine's running. You know you've charged. This is all about charging cells. Okay, cells that aren't functioning properly, it doesn't affect good cells. So you're charging the cells enough to where this ATP production or photochemical reaction, and the first reaction is pain. You know, people say, well, how deep does a laser go? Nobody really knows, because you could be a thin steak, a medium steak, or a thick steak. So the only way you know is by the clinical effect. It's not it feels better, it's significantly better on palpation. I like to teach that because patients, when they feel something, they're more apt to complete the treatment. I hope that makes sense.
Yeah,
And
for
actually,
sure.
David, I have the video. I think it's on the next slide, but I've got the video. When Dr. Sternbu's ready, we can show that.
That's an
Yeah,
old video.
go ahead, go ahead.
Okay, great. So I just am going to bear with me for just a minute. I need to share my screen and then also share my sound. So I'm going to.
I bet this video is 6 years old. You'll see my hair. Let's see how. I'm serious. It's at least 6 years old. I remember the day I made it.
All right, give me just a second.
That's a podiatrist. I was visiting her office around the corner.
Yeah, we're gonna do here and share sound, share. Okay. All right. Ready? Tell me if you can't hear the video.
810 and multiple wavelengths, but this one we're using today is an 810 and 980. It doesn't really get that hot. So you can actually take this and go in circular. You can go up and down with it. You can even press deeply into the area, right down to the bone with this, but you don't want to do it for more than 4 seconds. You always deeply palpate and make sure you have a trigger point area. Sometimes you should always do the medial, central, and lateral, but you palpate it, and after the treatment, you should repalpate it and demonstrate to the patient that there's resolution of the pain. If the patient says it feels better and you still palpate and you feel a little bit, do an extra 2 minutes. Now here's the motion of the REMI. You can go circular, you can go up and down. With the REMI, since it's multiple wavelengths, it's a 980 and 810, and there's other wavelengths, but the main ones are 980 and 810. You can actually deeply palpate into the area halfway through the treatment. So you're palpating almost down to the bone. There's no problem with penetration with this laser at all. You can go straight, you can go round. Halfway through the treatment, you can bend the toes back yourself or have the patient. Motion should always be performed halfway through the treatment. Up and down, you want to cover the entire fascia, but you want to get most of it in this area, which is the plantar medial insertion. Now, after you're done, how do you know you're really done? And that's, you palpate the area, and then afterwards, you repalpate it. If there's no pain, you're done. And that's very important. You want every patient to walk out of this office with no pain whatsoever. That's very, very important. I call it the wow experience. Wow, I feel great. You don't want a patient to say it's a little better, it's this and that, and you want to demonstrate to the patient whether it's the plantar medial insertion, whether it's the insertion of the Achilles. We're also going to talk about if the patient has decreased range of motion, you want to treat the equinus. Now this is pretty tight, so you're going to treat the heads, the triceps, and the insertion. Another thing that's important is that halfway through the treatment, you want motion in the area. Have the patient moving up and down, whether it's the Achilles and any specific pathology. Plantar medial insertion, plantar fascia, you want to move the toes up and down. So when you're treating this, move it up and down. Have the patient move it up and down. Would you like to move it up and down, your toes? That's the toes. Now what you're doing is you're moving all the intrinsics, the flexors, all of the intrinsic musculature of that area. So if you notice here, I'm moving it around. Now after a few minutes, I'm actually going to push into the area and move around. You never want to hold the area more than 4 or 5 seconds in the area. So you can go circular, you can go back and forth. You can treat a bursitis. That would be around this area. I go circular, and all these treatments are preset. You just press a button, and halfway through it, if it's a bursitis, I'm gonna move the area up, or capsulitis, I'm gonna move the area up and down and around. Same thing with neuroma. You palpate the area, you treat half of the treatment on the top, half of the treatment on the bottom. How do you know you're done? Well, after the timing goes off, pick up the foot, and if the patient has no pain, you're done. If they're not, add 2 more minutes.
All
Can I-
right.
Can I
Thank
critique
you.
myself?
What's that?
This guy did it all wrong.
I
Gotta tell you one thing.
thought this guy was a professional.
This particular laser was a lower wattage one. It wasn't 25 watts. So you got to be very careful going in short spaces now, because first we do the whole bottom of the foot and we cross the plantar medial insertion. If you go more than 4 seconds in a short area, it can get warm. So it's long strokes, about a foot from the heel all the way to the toes. That's a very old, that's probably 2018.
I think so. Yeah.
video.
Dr. Sherman, feel free to share
Yeah,
your screen again. Sorry
let
about that.
me try. Yeah. Let
If
me
you want
share.
to also, at the end, when you're finished, Dr. Streambo, I can also show, if you'd like, some of the videos of those presets that you mentioned. We have that preset quick.
Okay, let me find. I think we were.
I think you're on slide like 23. Oh, I lied. 21.
Here, okay, this is the next one. So this is a
Can you put it back
page.
in slideshow mode? There you go. Perfect. Thank you. Sorry.
Okay.
You're
Did it
perfect.
start? Did it start?
Go ahead where it says resume slideshow. Where it says from current slide. That's from current slide. And
Okay,
then
here we go.
Perfect.
So maybe now. So yeah, this is a patient that I had, a 70-year-old female with right heel pain. So she was going to Europe. And she came to me, really, she had no trauma, the pain, typical heel pain, worse with first step in the morning. So what she's done, she's did icing, Voltaren gel, Aleve, pain level was 8 out of 10. She really didn't have any medical problems, just sleep apnea, allergy to sulfa. Everything was pretty good, other than you palpate the fascia and you get the pain in the heel. So because she was going to Europe, she's like, I want cortisone injection because I want my pain to go away because I'm going to do a lot of walking. Of course, I said, well, why do you go to Europe? Let's make you some custom-made orthotics. I gave her some naproxen to take with her. I gave her over-the-counter arch support, told her to do stretching and everything else. So after 3 weeks, when she came from Europe, she was in so much pain. She's like, I'm ready to start the laser. I had said, you have to have the laser. And like I told you, I don't sell in one session because a lot of people will want to say, oh, I want to see if it works. I want to only get one session. I don't encourage that. You need to get it in 6 sessions because this is better, in a package. And I offered her, she's like, sure, anything. I have pain. I need to have it go away. And she came for 4 sessions and she was pain-free, but because she paid for 6, she still came for the 2 more. But it worked great on her. And for a lot of patients, actually, injection is not even one of my first treatment that I do for them. I offer them laser way before I offer them an injection. And people like it because some people are scared of cortisone injection. It's like, oh, injections. Some people are diabetics. Their sugar goes up with the cortisone, so they cannot have it, or they're scared that the sugar will go up. So I do a lot of laser and it works great. I even did it on a neuroma patient, which it worked great. He loved it. He's like, I can walk pain-free, no more pain, and it worked great. Okay, so here we go. Choosing the laser therapy. high dose laser therapy is most advanced healing technology available. It is the only modality that heals your body at the cellular level. Best known surgical treatment. Injections tend to be painful and expensive, and they only provide temporary relief. Medication only masks the pain temporarily and are highly addictive. And this is some final thoughts, some pearls that I have for this. Class 4 laser therapy is evidence-based treatment protocol for inflammatory heel pain conditions. Photobiomodulation is the use of light therapy to create a cascade of expedited healing outcomes when utilized with appropriate penetration and dosage. Patient response to palpation of the target area after treatment is the only true way to know if the dosage and time combination was effective. I think if you were to take one pearl, this would be the most important pearl, I think. What do you think, Dr. Zuckerman?
I agree with you. I agree 100% because everybody's body and density is different. And I think that you got to get it's like an antibiotic. You got to get the right dosage. And the only way to know is palpation, because the first effect of photobiomodulation is decreased pain.
And people are like surprised because they say, oh, it's a miracle. You palpated before, it's so much pain. You do the laser. And after that, at the end of the session, they step on the heel and they're like, oh, wow, no more pain. It's, yeah.
And they're more apt to complete your treatment and trust you because they see that they get a taste of it.
Yeah, definitely. A 30-watt laser using dual wavelength is more effective than laser for foot and ankle pain compared to 10 to 15 watts laser due to the vast amount of light energy that is not absorbed by the mitochondria due to reflection and scattering. Patients understand the gravity of surgical care and injection, and communicating their non-infection alternative is critical to optimal care. And I think that's what I had. That was my lecture, basically.
Very good. And you know what the interesting thing about it is? I think this is one of the first times. It's always, the REMI is multifunctional. The REMI it just doesn't do pain and inflammation. It does fungus, toenails, warts. We always call it's the Swiss Army knife of podiatry. It's one laser, it does multiple things. But if I had to pick one of the aspects of the REMI, the pain is the best because you see the results right away. When you do fungus, works well. And that's going to be another topic we're going to talk about in the future. We're going to have experts come in with experience and talk about one for fungus, one for warts, one for wounds. So you get to see all the aspects of the REMI. But that's what you need. You need a multifunctional laser that's powerful, portable, and affordable. You can't buy one.
Do you want me to show that video of the presets, David?
Sure, why not?
Okay, cool. Just a sec.
Yeah, and I have to agree. I mean, the pain, it's my favorite right now. I did start with the fungus. That's how I started with this laser because that's why I bought it. I bought it for the fungus. I wanted a laser that can do fungus. But when I saw how well it works for the pain, I love the pain. I could sell it all day. I mean, I present it all day to my patients.
Because they can see results right away.
Yes, definitely.
Fungus takes months.
Oops, here we go.
I'm going to go over the programs. It's pretty simple, but I just want to make sure you understand them. You're doing fungus toenails, and you press fungus toenails. There's the fungus toenails. It's 5 watts average power, 30 watt peak, 1 minute. Press the favorite. We're going to go back to mosaic warts. There's your program. It says it right up here, mosaic warts. Press favorites. We're going to do wounds. That's the wound program. It says it right up here, wounds. Press favorites to go back into it, and we've got pain 25. This is what I like to use for all pain, not post-op, 25 watt CW. Go back to favorites. There's a whole list here.
Neuropathy, that's the neuropathy program. It says it right up here. You'll be trained in each one of these. It goes from foot fungus toenails, mosaic warts, neuropathy, pain 25, sensitive patient. That's when it's particularly on the top of the foot, surgery or wounds.
Easy peasy. There you go.
Yeah, thank you. I do use it for neuropathy as well.
So we do have a couple of questions that came in if you guys are ready for Q&A.
Sure.
Okay, sure.
Cool. All right. First question, how can a physician, so I think that when you were on the slide regarding the protocols and it said some physicians do 10 treatments weekly, it says how can a physician implement 10 treatments weekly?
You mean for their protocol?
Yeah, on that slide and the
That's
protocol guide that we have, it says some physicians.
Yep.
I don't know why my.
That's a good thing. I know physicians that once a week. I used to do once a week for 6 weeks when I did this years ago. You can do it. You can't overtreat this. It appears the industry standard, how we came up with it, I'm not sure, is twice a week for 3 weeks. I used to do once a week for 3 weeks. You could do every single day if you wanted to. In the NBA and the NFL, that's what they use the REMI for. So how would you implement 10? Just say we're going to do 10. Like I said, do you need 10? I know there's some people that feel acute is 6, 10. Let's see, up to 6 is acute. From 6 to 12 is chronic. There's no scientific evidence that didn't you, Andrea? Didn't you do 4? Weren't you the one that used to do 4? Was that you? 4?
No,
No, it
I
wasn't.
do 6. I sell in packages of 6.
The-
And if people get, results, of course, they stop. But I do have patients who buy a second package because they feel relief, but it's not 100% and they want to, So I do have patients who buy a second set.
Yeah. I've had patients, and when I was in practice, I did 1 treatment and it's gone for 2 years. I've had knees where I've done 1 treatment, gone. But the industry statement, nobody knows exactly how many treatments are necessary. So the average is 6. It could be more. It could be less. If you want to do 10, you could do 10. I know one doctor that does 10. He does them once a week. Been doing it for years. He charges $1,000 once a week for 10 weeks. And that's his protocol. You can develop your own protocols if you want to, but there's no quote standard of care, but the industry standard at this point is an average of 6 treatments. I don't know if that helps you. Yeah, this is a return on investment. It tells you what you charge. For example, I don't know, it's been a while since I've looked at this one. If you're doing fungus toenails, is an average of 3 treatments. We're all learning together this. I have a picture of a fungus toenail where this podiatrist does 3 treatments 30 days apart and then brings them back for a 4th one in 6 months. Now, the reason why they do that is they want to get the patient back for an observation. But the FDA protocol for fungus toenails is 3 treatments, 30 days apart. Pain and inflammation, there is no FDA protocol that says you got to do X amount of treatments. The same thing with warts. We've just done it over the years that, you got to think about the patient too. The advantage of this is it's done right in the office. It's about 10 minutes, the whole treatment. It's not where you're going to physical therapy 2-3 times a week, and, not only physical therapy costs more, it hurts. So I can't really tell you exactly where the treatments came up. It was my mentors taught me. It's always been 6 treatments. If you want to do 10 treatments, you're not going to hurt the patient. Whether somebody will come in for 10 treatments, that's another story. You got to think in practical, terms. 10 treatments is 10 visits.
And if the pain is not gone, they will come. I mean,
they will come. Yes,
they
as
will
long as
come.
they see improvement, they're going to continue.
Yes, I agree.
I
And
wanted to say Sorry, I just wanted to share that because one of the questions was how much do you charge? So I'm hoping
Yeah,
that,
bring that. You can talk about that, Sarah, that one.
well, I figured that sheet, hopefully, if anyone wants that, I will
Yeah.
email it to anybody who requests it. It's
an
a
ROI.
PDF that we've got on the website. So, yep.
Yeah, it's an ROI. It tells you if you charge X amount. Believe it or not, I used to charge 15 years ago, it was $60 a session. And it would be, if you did a packet, it was $300. That was, wow, 2009, 10, somewhere back then. And I used to do 10, 15 a day doing paperwork in my office, and it was running by itself. You figure out what the profit was. You know, I always just say it's different now. I used to say if it could pay for one employee, it's worth having. But when I had my lasers, they were $30,000, $40,000. You can't buy a laser for $30,000, $40,000 and get a fast, quick return on investment. That's why I decided to manufacture myself to cut out the huge expense. I don't have a big building. I don't have a big sales force. You know, the doctor is the one that you got to win too. Patients got to win. The doctor's got to win. Everybody's got to win this. But I know doctors that have made a couple $100,000 off of this easily. So I'm kind of,
We have two questions, or actually 3 people that have asked about how to do neuropathy. So that's literally like 3 different people have asked. So I'm just knocking those out really nicely. But I don't know, Dr. Strimby, if you use it for neuropathy very often. We have some testimonials on the website, but David, what are you hearing from individuals who are using it?
We have changed the protocol. It used to be where we did, I was taught, a chiropractor taught me this about 10 years ago. They do a lot of neuropathy. We used to do the common perineal, the tibia, go through the tarsal tunnel, and then treat it like plantar fasciitis from heel to toe. But if you recall, most, unless somebody can tell me I'm wrong, most of the pathology is in the distal fibers of the nerve. So we're just doing the whole bottom of the foot for 6 to 10 minutes, and that's it. Twice a week for 3 weeks. But we tell patients, I don't think you can cure neuropathy. The studies show it's very good, but I don't think you can actually cure it. It's something that we can slow the progression, get rid of the burning, the stinging, the pain, difficult walking and sleeping. But once you get it control, they do need to come back for evaluation and further treatment. I mean, who wouldn't come in every 2-3 months to get 1 or 2 treatments? It's gotten I'm very impressed with the results I'm seeing with neuropathy. Very impressed. I mean, we also do chiropractic. I mean, I know groups that's all they do is neuropathy. And the reason why we started doing just the bottom of the foot from heel to toe was they didn't have the time. They had 2 lasers going. They didn't have the time. So they asked me to pick it up a little bit. Is there any other way? And I said, why are we doing the common perineal? I mean, what's the chances of, I'm not saying you could do it. You can go back if there's neuropathy changes, but in a diabetic, it's the distal fibers of the bottom of the foot.
Yeah, and I do the same thing. I mean, I do the bottom of the foot, 5 minutes, 1 foot, 5 minutes, the other, and the same thing. I do it in 6 sessions. I find that people with neuropathy will buy a second package because they do feel better, and they're not, I mean, it's not resolved completely. So they are hoping to get it, almost resolved, which, like Dr. Zuckerman said, neuropathy has no cure. So you combine it with the B12, with the Metanax or EBM and 6, whatever you use for the nerve fiber regeneration, you could use I do 5 minutes each foot. I charge the same. It's a little, I mean, I should charge double because I spend 10 minutes instead of the 5 minutes that I do the heel protocol. But and then for the nails, it depends how many nails. If I do all 10 of them, I will charge $4.95 a session, that is. So, and I tell them, listen, minimum 5 sessions, minimum, so they know what they're in for. It could be less, it could be more. I don't know how long it's gonna take to cure your nails. I mean, maybe you had fungus for many, many years. And sometimes I will have to combine with another, with the topical or even pills. Some people say, I want this out really quick. I will put them on pills as well. I will do the laser, I will do topical medication. and they will pay $495. If they only have, say, 2 nails, I may say, oh, it's $300. You don't have to, you know, a session. That is, the nails are a little more expensive than the pain laser. But anyway, for people who have copays, if they want to go for physical therapy for heel pain, some of them have like $50-$60 copay.
Yes.
And then they have to spend like half an hour to 45 minutes in a physical therapy place when they come to me in their lunchtime, and I do 5 minutes and they're gone, and that's it.
Yeah. Very convenient, and it's comfortable. Physical therapy hurts.
Yeah.
It hurts. It can hurt. I shouldn't say it hurts all the time.
Well, but it takes time. It's time consuming.
Yep. It's cheaper it's more economical for the patient.
Yes.
Much
David,
more.
this will kind of give you an opportunity to chat a little bit about the Remy 45, the Remy FX at 45 watt. We have a question. Have you tried a 1064 watt laser for pain?
Yes. In fact, that's the Remy FX. It's a tri-wave. I mean, the 980 is for analgesic. The 810 is for deeper penetration into the mitochondria. And the 1064 goes deeper as well. And I want to make a point of how I really think lasers work. But the more wavelengths, the reason why I like 3 wavelengths is you can get all the way up to 45 watts. And that's the beauty of the Remy FX. It's starting to get more popular in podiatry. Do you need it? No. I've made it much more affordable because we're now buying in much more volume. It used to sell for 25,000. It's under 20 now. But it's more stationary. It's 12 pounds versus the Remy 30, 4 pounds. You know, it all depends. They both are high powered. 30 watts is a high powered laser. You know, 45 is a stealth. I happen to like the 45. I can treat my neuroma in a minute, as opposed to, you know, up to 5 minutes. It's quicker, faster, much more energy. It's all about power density, joules per centimeter square. But, you know, we have more 30 watts out there than we do 45 watt lasers. It may change, it may not change. But my point with the triple wave is it's all about getting as much energy into the target comfortably. And that's what the 3 wavelengths do. We used to have 1 wavelength where you could never get up to 45. You maybe get up 20, 21. The fact you have 3 wavelengths, you can get up even higher. We just came out with, and I developed these lasers because distributors wanted it. It was never specifically developed for podiatry. The 45 watt, we now have triple wave 90 watt lasers where you can go triple wave 60. It doesn't go up to 90. It has a 90 watt diode in it. You can go 45 watt triple, 60 watt triple, dual wave. So it has every combination. Is it a podiatry one? You don't need it. I mean, it's not like one is 50,000. They're all reasonably priced and close by. And I did that so you don't have to make a decision on the price. It's what you want. You know, I love the 30 watt. We got the 30 watt has been out for years. The 45's been out for years. We just went up to the 60 watt triple. You know, so it's what the market wants is because I design them. So, you know, there used to be big price differences between them, but we have the exclusive on these lasers. So I was able to manufacture in large quantities because when I do that, I can get the price down. I mean, it's, you know, $22,000 for a 90 watt laser with 4 wavelengths in it. It doesn't exist today. First of all, nobody has that laser. And the second thing is, you know, a typical laser, if you shop around, a 30 watt laser is going to cost you $40,000. I mean, the return on investment's a waste of time. And you can't buy a laser today, one for pain, one for warts, one for nails. It's just not practical to do something like that at all. So, as Sarah would say, what? Powerful, portable, and affordable.
PPMA.
I agree.
What about drop foot at fibular head?
That's a good point. You know, Steve Barrett did in fact, his podcast. He's an interesting guy. You should absolutely listen to some of his podcasts. But he used the Remy laser with lidocaine plain, and he got blood flow to the common peroneal nerve, and you saw motor function return in the foot. They're also talking about, I've seen case studies with the 1064 where people have paralysis and it's starting to come back with a 1064. You know, I don't see why a 1064 would be more, you know, better than a 980 or an 810. To me, it's the fact you put three together and you can get more energy into the area comfortably. Now, the 1064 is absolutely, they've done studies. This is a future thing. They're doing it now, but we're actually doing studies in university for pain, depression, anxiety, post-traumatic stress disorder. That's been around for years, but they're actually doing studies where you can do EEGs to do subjective outcomes. I have lots of wellness MD centers that are doing that. And they're the ones that said, we need a 1064. You know, I don't want your 30. I want your 1064. So even the US government bought one of the my triple waves with a 1064 because they're using it to eradicate bacteria, Pseudomonas, in food. You know, so there's a lot of, you know, there's a lot more to just musculoskeletal conditions, a lot more, you know, but you're going to see someday. My vision has always been with lasers. If you have colitis, you don't have to have medications. You don't have to have surgery. Right now they can put a fiber down your, you know, inside of you and removes the inflammation. Can you imagine if you had pericarditis inflammation, colitis inflammation, and they just laser you to remove the inflammation without a non-invasive? That would be pretty good. You'll see that in probably the next 10 years. You know, I haven't been involved in studies with that, but to me, that would be amazing. You know, musculoskeletal is amazing. You know, the pain industry is 85 billion. I'll leave it with one thought. Podiatry sees for tendinopathy, fasciopathy, trauma, sprain, strain, we only see 8% of the population, and we're busy all day long seeing plantar fasciitis. We only see 8%. And I'll tell you my opinion why. Nobody wants to have a needle in their foot. You know, they don't want that. Who wants to come get a needle in their foot? You know, they don't. That's one thing COVID did. People don't want needles. Steroid injections. I've seen steroid injections. I'm not saying they're bad. Everybody has their own opinion on them, but I have probably produced every side effect you can imagine with a steroid injection. I've seen intrinsic muscular rip for neuroma where you get a hammer toe. I've seen the plantar fascia rip. I've seen fat pad degeneration. You don't get any of that with lasers. I'm not trying to say lasers is God gifted. Well, they might be down the road. Someday they may. If they can help systemic problems down the road, they may be a lot more, you know, God's gift to man. You know, as he said, let there be light. It's light.
And you'll be surprised how many people are scared of the needle. Once you present them with the laser, they're like, let's go, laser. They are scared.
I always suggest you should demonstrate the laser on yourself because lasers in some people can be scared. They're coming at them with, you know, the handpiece, you're ready to go. I would always demonstrate it on yourself for them or on their arm in these nervous patients. Always give them an idea. But
go ahead.
So we have another question, and this does actually have to do with injections. So what adding PR, I'm gonna try to like rephrase it. Would you ever add PRP type of injection with the laser?
You have lots of doctors. PRP, amniotic stem cell. First of all, lasers stimulate stem cell. They're synergetic together. You'll get much better outcomes if you add the laser to PRP or stem cell. Plus, if you're going to get an injection, you laser it first. It makes it less painful, more comfortable to stick the needle into the body. So the answer is they work well together, and that's from a lot of feedback that I get from podiatrists that are doing this. Lasers, and it's just not my laser. There's all lasers out there, you know, do that. It's very common. Lasers and regenerative medicine together.
So earlier, David, you had said that, correct me if I'm wrong, that the FDA clearance for toenail fungus is every 30 days. But so because we have a question that says, can the nail treatment be done weekly? And are there any contraindications?
Yeah, it can be done weekly, but you want to get past the 90 days because even with Lamisil, that's why it's 90 days, because you can get reinfection at that particular time as the nail's growing out. So that's why you have the once a day for 30 days, 90. But with a prescription, we have doctors, and we not a lot, but we sell lasers to the public. And I've had doctors, if somebody's buying a laser and they're not in a practice, say it's a doctor, a relative, he's doing a relative, once a week is amazing. Once a week until it gets better. But the FDA study showed over 75% of the cases were excellent or good with 3 treatments 30 days apart.
I'm definitely excited to share that picture that you texted me today.
You should show it. It's amazing. That was done
I
by.
know it's on my phone, so I'll email it to everybody. It's
amazing. We have more like that, but it was Dr. Ellsworth from Dallas, Texas, sent me this. He does 4 treatments, one every 30 days, and then the 4th one at 6 months. I mean, it was a real shitty nail.
But I'm gonna let me see if you guys can see. Can you see it? No, it's not gonna work.
No.
Well, that's okay. I'll email it to everybody.
Maybe I can bring it up. Let's see if I don't know how I'm gonna do it.
If you have it on your computer. Well, we are hitting the hour mark, and so I do want to. There's one more question sitting here, and then David, I don't know if you wanted to talk about financing options really quickly before we sign off, but really quick, the last question for Q&A is what is the cure percentage? And the participant who asked didn't specify with fungus, pain, warts, but so answer however you see fit.
Well, if it's pain, people say, how long does it last? It can be days, weeks, or months. It's like a steroid injection. You're getting rid of the inflammation, you're stimulating the healing, but a laser is a tool. Okay, meaning that you have to check the biomechanics, orthotics, stretching, taping. It's a program. It's just not the laser and you're out the door. With fungus, the FDA, I don't think it's over 90%, even though I have a lot of my laser users saying it's at that rate. But the FDA study we did one single wavelength and it was done in the study, but we added 2 to it. I feel very comfortable to say it's anywhere between 70 and 80%, maybe a little more. It's fungus. Everybody's different. There's biomechanics, there's genetic, it's just not like you have periodontal disease and there's no, what do you say? There's no structural deformity with it. I mean, how many times, I'll never forget as long as I live. I'll give you an example with fungus. I was in my practice and I got rid of the fungus with a laser on one foot. My associates were doing the other foot and they couldn't get rid of it. And the guy had a bunion. I removed the bunion on one foot. So he's got one bunion on one foot and one not on the foot. And the shoes were a different size. So I said, you got to go fix the bunion or get a bigger shoe because shoe pressure will create fungus. Did I answer that question? I will tell you to end this because I know we're getting close. I was very fortunate to find a finance company. It's a no-brainer. And when you hear it's not a lease, it's a finance company where it's 0 payment for 6 months, 99 for the next 6 months. Then it's a fixed rate for it could be 3 years, 4 years, 5 years. If you do it over 5 years, it's costing you less than $10 a day to own the laser. $10 a day, could be even less. That's an average. And it's a bank. It's a bank, but we're doing it for 6 months. It's not where there's no interest. It's like when you buy a house, you're paying it off on the day up to, the day you buy it. There's no future interest. A lot of these companies will charge you like a car. If you buy a lease in a car, you have to pay the whole thing regardless. But this is an amazing program. It's just amazing. To tell you the truth, I don't know why doctors put stuff on credit cards and stuff. Can you imagine having a laser and it's going to cost you $600 the first year to have it? I always say if you can't meet a payment of $300, between $300 and $325, you shouldn't buy a laser or Remy. You shouldn't.
You easily get your money back and much more easily.
Shocking. I pinch myself when I hear the story. I said, "Whoa, what did I create?" But we're always thinking about the future. You'll see a lot of new stuff coming out with the Remy. I just started a study. It's going to happen in the next couple of weeks where it's going to be the Remy, aesthetic Remy, where you can do spider veins. You can do all kinds of skin discolorations, a lot of stuff. We're always and Sarah came up with this, the Remy Simply More. We're always simply trying to add things to make it one laser can do multiple things. That's
Oh,
the
and
Remy.
you know what? Another thing that I like about this Remy is that you guys provide the marketing material. I mean, you have everything that you need to market your Remy, and I like that I got that because I use it a lot. You get postcards, you can get it for your website, or anything you need, you support, and that's one of the things I like because it did help me a lot.
Yeah, you need to have good marketing, good training. We just don't give you the manual and goodbye. It's we certify you for a lifetime, the doctors, the staff, but I'm always here to help you because this is what I like doing.
Yeah, and even the brochure and everything. And you can print out the brochures, just, you put your practice name on it, and you print it out and keep it in your office, and you can mail it to your primary care doctors, let them know you have the laser, to your patients, emails, Facebook, everything.
And if anybody can come up something that's even better with the marketing, we make it for you. Pull up banners, there's all kinds of stuff that's on there. So I think we're over the 9 o'clock.
We're in good shape, but thank you guys so much. Thank you, Dr. Strimbu, for your presentation. David, obviously, fantastic. Just to doing that little video of your quick in-office training is just a snippet. I mean, David does the most. We get a lot of testimonials about how fantastic David is with each practice and the team and making sure everybody is properly trained on every single protocol. So there's, what's that?
Not just once, we work with you all the time. I want you to be successful. I can only promise you two things: great service. I want your patients happy, and more important, I want the practice happy. That's my goal.
And that's true.
And I mean, we have so many testimonials that prove it over and over again. I keep getting more in my email, and I've got more videos to make, so I'm excited about that.
I want to thank everybody for taking the time for coming out and listening to this presentation.
Yep. And we had a lot of people stay on until the very end, so we appreciate that. Anne, did you have anything you want to say before we sign off?
No, I'm all set. Thank you guys for joining us, and we will see you next time.
Yes, our next webinar is going to be April 8th, and that is with Blue Orchid Marketing, and we are going to be discussing how to get press and nail it. So you don't want to miss that one. A fun marketing session. But all right, you guys, if you need any more information about Remy, remylaser.com. It's pretty simple. And Dr. Strimbu, I know you shared your information on your last slide, so I know you usually welcome anybody if they have questions, reach out to you as well.
Sure. If anybody has any questions, they can reach out to me. My email, adrianastrimble@aol.com.
Perfect. All right. Thanks, you guys. Have an awesome night, and check your inbox. Bye.
Good night.